Merhaba. Aslında bugün bu konuşmayı...
Hello, today actually this speech was going to be presented by my professor, an associate professor at our university, and due to family commitments she couldn't make it. So I will present in her stead. I'm a PhD candidate at Sabancı University, and at the computer imaging lab I work on medical imaging, and thus far I have taken part in several different projects. Organized also by the Scientific Board of Turkey, and I have also been awarded, my team has been awarded a couple of international first prizes. Today I'll be talking about challenges in neuroimaging. First of all, I'm going to focus on artifacts, their types, and how we can do away with these artifacts. Then I will talk about diffusion tensor imaging, and this is my current area of focus, and I will also be comparing this with the limited modification system, which is a new method. During imaging there are certain artifacts, the convergence artifact being one of them, and also due to motion certain artifacts might occur during imaging. Also ringing these formations, these zigzags on the borders of the images, zippers, yet another artifact like you see on the screen. There are so many different artifacts that we can talk about, but specifically I'll be talking about the motion artifact and the convergence artifact. As for convergence artifact, the reason is the small area of the imaging site, and its appearance is as follows. There's a reflection on the opposite side of the site. In order to correct this, we need a wider vista and we need more sampling. Here are some, this is more about diffusion. First of all, on the image itself, we determine the artifact, which is currently uncorrected. We look at the map of this, color map of this, and we see that there is an irregularity here, and then we correct this by employing certain methods, which I will go into shortly. You get the new map, and you have the final correct expression of the tracks. The second type of the artifact is the motion artifact, and the reason for this is during the sampling, motion causes changes in phases or voxel velocity, and these result in coding errors. It is rather like a recurrent pattern, and at regular intervals the phase coding is repeated. You can get the mean value of a couple of signs to correct this, or you can repeat, or if you speedily complete imaging or image acquisition, you can solve this problem. This is the impact of the motion artifact on fMRI. At first, there are no artifacts on the image. And on this image, the gray matter's volume is calculated, and then this artifact was increased and became more prominent, and we realized that the volume went down substantially. I've talked about the artifacts, so how can we do away with these artifacts? The first method is to get rid of the noise in the image with kernel or the filter. We can filter the image. The Gauss filter is the first option. This is a statistical filter. It works on the white noise and it creates a blur effect on the noise. The second one is the mean filter, non-local mean filter, and this works on the Riccian noise, diffusion intense noise, and it creates a blur effect as well. And thirdly, we have the paranormalic filter. This is more complex in nature. It blurs the noise, but also protects the edges. This is the noisy data, the first image, and the second image is after we've used the Gauss filter. Here you have the fMRI imaging. There are 4 areas that we picked, and we looked at the activation on these. At first there is no noise, and then there is the inclusion of noise on the data, and without any noise reduction, sensitivity measurement was checked, and this was below 5%, it was seen. And afterwards the Gaussian filter was used in order to soften the image and get rid of the noise. The sensitivity measurement was done again, and the value that we got was higher for 4 areas. Before the smoothing, these are the sensitivity values, less than 10%, and after the Gauss smoothing, these values increased for all the areas involved, and increased in a substantial manner at that. The second method is a method that we apply on a blurry image and make it more clear. This is the before picture, and this is the after effect once you get rid of the blurring effect. This is yet another example of this clarification. This is an image with a motion artifact. In order to clarify this, you apply the filter on it and you get the result. This is an fMRI image. No smoothing was done on this image. And in the areas outside the cortex, activation was checked, and we found active voxels. But once we made it more clear, the number of voxels outside the cortex went down. This is a similar study for 3 sections, non-corrected and corrected images. The green bars denote the number of voxels outside, and the yellow ones are the corrected images and the number of voxels, and there's a substantial difference when correction is applied. Now let's talk about diffusion tensor imaging. Very briefly, I would like to give you a recap, and then I will talk about CST. In diffusion tensor imaging, white matter is screened by using the diffusion tensor imaging method. Different gradients are used, and you get a diffusion intense image for every voxel. You measure the diffusions, and you juxtapose that with the tensors, and you get fiber orientation sections, and then you apply tractography, and you find the tracts, the pathways, and these different colors denote different directions. Now, let me give you an example as to how this is used in psychiatry. Diffusion tensor imaging comes quite handy in terms of assessing bipolar disorder, and these are some of the examples that I found in literature. As for white matter, in bartography, DTI is used quite intensively. This is just one example. These squares represent voxels, and in these voxels there are fibers. These 2 voxels, the fibers are one directional, whereas in the third one they are bidirectional. And when you model this with DTI, you get an ellipsoid. This is the DTI equivalent of that, and For the first two unidirectional fibers, the main direction of the ellipsoid tell us the direction of the fibers. But the third image, in the bidirectional one, we can't really tell the direction of the fibers. For the intersecting fibers, we need to use more advanced methods, and that's why we have the CST model, which is a more complex model. This is another example. This is the brainstem. Tractography was performed on this area, and the CST method, the corticospinal tract, you get the intersections as well, whereas on DTI you don't have that. This is a schematic example. White matter, dissection, CST tractography from one single outlet, and the algorithm was used to uncover these tracts, and this is the result of the DTI tractography. This is a clinical study, and this was performed on two patients. On both of these patients there are brain lesions, and diffusion intense imaging was carried out. Again, on the brainstem, tractography algorithm was initiated, and these this is the DTG results, dark blue, and the red shows us the results of CST tractography. In the DTG, in the cortical spinal tract, there is no danger observed, but here, especially in this picture, we see that there is a hazardous situation in the tract. Now, conclusions. Imaging causes artifacts, and I've covered these. In order to correct these, we can use smoothing, clarification, or getting rid of the noise, and we need to do this before classification. Also, spatial normalization and juxtaposition can also increase accuracy, because brain structures of the patients or sizes of the brains might be different. We need to normalize these and also get rid of the transformations and juxtapose it with an atlas in order to get more accurate results. And I talked about the CST method today. For the white matter, this is the better tractography option. Thank you.
Sorunuz varsa alayım.